Hello, I'm Stephen Figiel. I'm the medical director for the Geriatric program at Ridgeview Institute. Just want to tell you a little bit about the exciting developments that we're doing right now to help with our program development at Ridgeview. There's several features of the program here that I think distinguish us from a lot of the other programs in the city, the state, and even in the country. Number one, when we're taking care of our elderly, we have to make sure that they receive the proper medical care, neurologic care, and psychiatric care. So to ensure that, we have a very solid team of internists and nurse practitioners that are here 7 days a week, which is very unusual, and that the same medical team and the same geropsychiatry team is seeing your loved ones and your friends who are in the hospital 7 days a week. Oftentimes at other hospitals you'll have a breakdown of care over the weekend where you'll have doctors that aren't necessarily trained in taking care of geriatric patients covering for the Monday through Friday doctors. So our weekend coverage is the same as our coverage is Monday through Friday. In addition, we have a full-time internist, Dr. Brandon Peretz, who's going to be available to us 7 days a week, rounding with the psychiatry team, which is also very unique and unusual as far as providing a high level of care for our elderly patients who have multiple medical problems along with their cognitive and their psychiatric problems. In addition, and as part of our practice, we have medically trained nurse practitioners who we have specialty trained also in dementia care along with psychiatric care. So another layer of care that we're providing beyond the geriatric psychiatrist and the geriatric internists, we have nurse practitioners who are here 6 days a week providing medical care and psychiatric care for your loved ones. So those are very unique features which I think allow us to provide a very, very high level of care for all of the needs of your loved ones, including their psychiatric care, their cognitive care, along with their medical needs. Part of why I liked coming to Ridgeview was the units that we have here are very beautiful and they're very nicely designed. Many of the patients we take care of come in with a history of cognitive problems along with behavioral problems such as anxiety or agitation or trouble sleeping. And the design of the units really helps us understand how much of the problem that the patients are having is related to the environment that they're in. Many times units, either at assisted living facilities or even in hospitals, aren't designed properly. And the patients are left to isolate themselves in their rooms, or they get lost in the nooks and crannies of the hallways of the units. And that in and of itself can lead to further anxiety, isolation, or sleep disturbances. So once you visit us here at Ridgeview, you can see how beautiful the units are designed, and that allows us to really minimize the agitation and the anxiety just through behavioral approaches and behavioral interventions, and also minimizes the need for medications, which is extremely important. Also, which is nice here, we have several geriatric units. The plan right now is to have 3 separate geriatric units, which is going to allow us to further separate our geriatric population into different populations depending on the needs of the patients. We're going to have a unit which is specially designed specifically for high-functioning, cognitively intact elderly patients who are having trouble either with very, very mild cognitive problems or for patients who are coming in for mood disorders. So again, the point is we're going to have one unit which is going to be designed for patients that are very, very high functioning, that don't have a lot of medical problems or don't require a lot of assistance with their bathing and ADLs. And the plan right now is to have another unit separate for patients who are coming in with the majority with established cognitive problems, who are having behavioral problems such as sundowning, agitation, or sleep disturbances. And we're going to have a unit specifically designed for patients who have those particular needs. And then the third unit right now we're thinking of is for patients that just require a higher level of care due to their medical problems, who have gait instability problems, or who need help who need a fair amount of help with their bathing and their dressing. So we're going to have a unit specifically dedicated to those patients. So that's relatively unique also in the community, to have 3 separate units where you're able to stratify and apply specialty needs for the patients depending on what their needs are. Come on out and take a look at the facilities and meet the staff here, and we'll give you a tour and further educate you and train you in what we're doing here. Again, we're going to be taking care of the entire spectrum of needs of your patients, including the psychiatric needs, the cognitive needs, and the medical needs. One thing that's very, very important, I was lucky enough in my training when I was in academics to train at Washington University in St. Louis, and I was trained there for 5 years and was able to learn how to diagnose Alzheimer's disease at a very, very early stage. And that has turned out to be a huge benefit in my training and my taking care of patients, because the majority of patients who have Alzheimer's disease never get diagnosed properly, and even more so of a problem, very, very, very few of patients with Alzheimer's disease ever get diagnosed at an early stage. So we're able to also evaluate and assess patients at a very, very early stage of their cognitive problems, and further provide the correct diagnosis for the patient and their family members to help them understand what they're dealing with, and also to provide the proper level of care, and to make sure after discharge they continue to receive the proper level of care in the safest, most therapeutic environment for the patient, and to work with the families and to help the families make sure that they're able to provide the safest, healthiest level of care for their loved ones. So I look forward to meeting you down in the future, and hope to see you here at Ridgeview. Thank you very much.